Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Stellate Block. Introduction. Some people experience pain in their arm because of the way nerves interact in their body. A stellate block can be effective in reducing the intensity of this type of pain. If your healthcare provider recommends a stellate block, the decision whether or not to have this procedure is yours. This module will explain the benefits and risks of this procedure. Anatomy. Nerves carry instructions from the brain to other parts of the body. The sympathetic nerves are a division of the nervous system. They control many important functions, including opening and closing of the blood vessels, increasing the heart rate, and opening the pupil of the eye. The stellate ganglion is part of the sympathetic nervous system. It is located in the neck, to the side of the feeding and breathing tubes, close to the carotid artery. The carotid artery transfers blood to the brain. Symptoms and their causes. Severe arm pain can occur because of an increase in the activity of the sympathetic nerves in the arm. With this increased activity, the skin becomes very sensitive over time, and the slightest movement of the arm may cause severe pain. Later, the skin may start to dry. The hair may start to fall out, and the fingernails may become very brittle and easily broken. All these symptoms form the syndrome of complex regional pain syndrome. This syndrome used to be known as causalgia, reflex sympathetic dystrophy, or sympathetically mediated pain. The causes of this syndrome are varied. They include minor trauma, fractures, hand or arm surgeries, a pull on the arm. Stellate blocks may also be useful for pain in the face. Blocking the sympathetic nervous system of the arm or to the face can take away the pain. The blocks at first may stop the pain only temporarily and may need to be repeated before the pain disappears for good. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. The procedure. The aim of this procedure is to numb the stellate ganglion in the neck to alleviate pain in the arm. The procedure only takes a few minutes. The skin in the front of the neck is disinfected. A longer needle is then used to deliver numbing medicine to the stellate ganglion. This should not be very painful. You should hold still to avoid damaging surrounding structures, such as the feeding or breathing tubes and carotid artery. Once the block is done, the arm pain should start to decrease, if indeed you have sympathetically mediated pain. You will also notice that the eyelid on the side of the injection slightly droops and that the pupil on the same side is smaller than the other. Risks and complications. Because of significant advances in technology and medications, this block is safe, but there are some possible risks and complications. You can do a lot to prevent them. You should make your healthcare provider aware of any medical problems that you may have, such as heart or lung problems, strokes, and liver damage. It is also very important to make your healthcare provider aware of any medications you are taking. These include over-the-counter medications such as aspirin, Advil, or blood thinners such as Coumadin. Medication you are taking could interact with anesthesia medications or could cause you to bleed excessively during this procedure. It is also important to tell your healthcare providers whether you have any drug or other allergies. This allows your healthcare providers to stay away from medications that you may be allergic to. There is a small risk of infection or injury to the stellate ganglion or arteries and veins of the neck. Injury of nerves to the arm is also possible. Injuries to the feeding or breathing tubes are also possible, but they are rare. Seizures, heart rhythm problems, and heart arrest are also rare complications. Your healthcare provider is prepared to treat reactions to medications used. These reactions could be fatal. It is important to inform your healthcare provider of all your known allergies.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Some people experience pain in their arm because of the way nerves interact in their body. A stellate block can be effective in reducing the intensity of this type of pain. Severe arm pain can occur because of an increase in the activity of the sympathetic nerves in the arm. This syndrome can be called sympathetically mediated pain. The aim of this procedure is to numb the stellate ganglion in the neck to alleviate pain in the arm. Stellate blocks are safe and may relieve your arm pain, but there are some risks and possible complications. Most of the complications can be prevented through good communication. Make sure to inform your healthcare providers of all your medical conditions, medications, and allergies. Your family history as it relates to anesthesia is also important. To do a stellate block, your healthcare provider will inject a numbing medication into the neck. This should not be very painful. Once the block is done, the arm pain should start to decrease. Let your healthcare providers know in case of fever, signs of infection, shortness of breath, or any other new symptoms that you may have after this procedure. Thank you for using Explain.